Hello, my name is Laura Nicole, and today I will be demonstrating the correct application of layered surgical dressing using a pillow, which I have right here, as my simulated patient. For this demonstration, I am presenting a post-operative dressing for a C-section, which is a surgical procedure involving a low transverse incision across the lower abdomen for delivery of an infant. So for instance, if this is my patient, and then this is the abdomen, the low transverse incision would be right here. So before any dressing is applied, proper skin preparation is essential. In this critical setting, I would begin by gently cleaning the incision site with sterile saline and gauze. So I'm going to go ahead and lay my patient out long way. The incision, I'm going to use this pin, which would be my marker, would be right about here, would be the incision. So let me go ahead and grab my sterile water, which would be this right here, and some 4x4s. This step removes residual blood, prep solution, and debris. Thorough cleaning is necessary because dry blood and leftover anesthetic can irritate the skin, interfere with dressing adhesion, and increase the risk of post-operative infection. Clean, dry skin provides the safest foundation of dressing placement. I will now begin applying the dressing layers. The first layer I am placing is a non-adherent layer. In this demonstration, I'm using a napkin to represent a non-adherent 4x4 dressing, such as Taffa. This layer is always placed directly over the incision because it protects the wound bed and prevents the dressing from sticking during removal. For a C-section, it is common to use two standard non-adhesive 4x4s to ensure full coverage of the incision. Okay, so like I said, with that marker, the incision was right here. I have my sterile water, which I would use, pour it onto my 4x4. I'm gonna pat clean around the incision. You don't wanna rub, you don't wanna go over the incision. And then you dispose, grab another 4x4 with the sterile water and pat. And then dispose. We'll get another 4x4 and we'll lay it across the incision. For the second layer is the absorbent gauze layer. I am using a paper towel in this case to represent plain gauze. This layer provides light to moderate absorbent and adds gentle cushioning over their non-adherent layer. It is placed second because it supports the initial protective layer and manages any post-operative drainage that may occur during early recovery periods. Next, I am going to be applying a ABD pad layer, represented here by a folded cloth towel. ABD pads are designed for heavy absorbent and protection. Although C-sections incisions are typically produced moderate drainage, the ABD pad offers additional bulk stability and shielding from external pressure. So I'm going to use this and apply it over my incision. It is placed third because it is most absorbent and protective component of the dressing sequence. Finally, I will secure the dressing. I am using household tape to represent surgical tape. In practice, paper tape or silk tape would be used depending on the patient's skin sensitivity. For a C-section, the dressing is typically secured with 3 or 4 horizontal strips of tape to ensure stability without restricting movements. Okay. And I'll put it across this way. And I'll grab another piece of tape. Apply it this way so you can see. Do you see this one? And then the strip here. Although drains are not typically common, standard in C-sections, I will briefly address drain care for additional purposes. If a drain was present, I would apply a drain sponge, represented here by a small napkin with a slit, for instance. So let me grab one. The drain site is dressed separately to absorb leakage, although the tubing protect the surrounding skin to reduce its infection risk. The dressing also helps stabilize the drain and prevents tension at the insert site. So for instance, let me lift my patient up. Have this little slit in it. I would put it here, and then the drain would be in there to go in between it. At this point, the dressing is complete. I have demonstrated each layer in the correct order and explained the purpose of each material and secure the dressing appropriately. This multi-layer technique protects the incision, manages drainage, and promotes safe post-operative healing following a C-section. Thank you very much, and I hope you enjoyed.